2022. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, Toronto Fire Chief and COVID-19 Incident Commander Matthew Pegg, and Toronto Councillor and Chair of Toronto's Board of Health, Joe Cresson. Mayor Tory.
Well, good morning and thank you, Brad. We are continuing to make progress helping people to get vaccinated, first dose, second dose, and third dose. We have now delivered more than 1 million third doses to eligible residents of the City of Toronto. And that booster effort is continuing non-stop in the face of the Omicron variant, along with our push to get kids vaccinated and to help education and childcare workers to get vaccinated so that the province and school boards can get back to in-person learning on January the 17th. Back to school is what we all want, and we are doing everything we can at the City to support that and to help make that happen. I visited the city-run Woodbine Mall Vaccination Clinic together with Dr. Davila and Councillor Cressy on Sunday, where we worked with the school boards to help hundreds of education workers get vaccinated with dedicated appointments. We also helped hundreds of education workers get vaccinated yesterday at the city-run clinic at the Scarborough Town Centre. And these dedicated clinics will continue next Sunday with 2,400 more dedicated appointments, along with school-based clinics happening across the city. Team Toronto has scheduled 27 school-based clinics over these 2 weeks to help kids and workers, education workers, to get vaccinated, and that in turn, of course, will help us to get the schools open safely. This is Team Toronto in action, working together to get doses to the people who need them. We know from our experience, however, during the first and second doses, that we have to work hard to make sure that vaccines are available to everyone, everywhere, across our city, without exception. And that involves addressing some specific challenges of different kinds faced by some Toronto residents and some Toronto neighbourhoods. That is why we are working now, even while demand remains high everywhere for third doses, to make sure that we can do everything we can to ensure vaccine accessibility in all neighbourhoods. Getting vaccinated should not depend on your postal code or on your economic status. Today, I want to outline the work that Team Toronto is doing right now to rapidly increase third dose uptake in neighbourhoods that are under-vaccinated and have been disproportionately affected by COVID-19 throughout the pandemic. First, we are bringing hyper-local vaccine clinics directly to where people live, initially focusing almost 100 clinics at Toronto community housing buildings. 24 TCHC buildings were completed in Phase 1 before New Year's Day. 36 Toronto community housing buildings have clinics planned for Phase 2 in the first 3 weeks of January, and an additional 37 Toronto community housing buildings will have clinics in Phase 3 towards the end of January and into early February. Toronto Community Housing has a dedicated team doing building outreach in the days leading up to the clinics with door knocking and phone calls to alert residents of those buildings to the existence of these targeted clinics. The City is working with Toronto Community Housing for targeted VaxTO text and phone messages to be sent to all building residents leading up to the clinics to help increase the turnout. This is continuing work that Toronto Community Housing has been doing throughout the pandemic to ensure that their residents get vaccinated. Toronto Community Housing has supported 474 clinics to date. 440 of those clinics were on-site in buildings, and we have supported 34 clinics off-site, community-based clinics nearby Toronto Community Housing buildings. I want to thank Toronto Community Housing for being a crucial part of this vaccination effort, and I want to thank Toronto Community Housing residents for doing their part to get vaccinated. Along with the hyper-local clinics, our plan to drive up third doses in all neighbourhoods also include, secondly, targeted school-based clinics for 5 to 11-year-olds, their family members, and educational staff in targeted neighbourhoods. Thirdly, dedicated appointments and vaccine clinics for people who live in neighbourhoods with lower vaccine uptake. Examples of this include Humber River Hospital setting aside walk-in appointments for education and childcare staff in the Northwest, and UHN providing dedicated appointments to underserved communities in the downtown West. The fourth element of this program is extensive community-based outreach, knocking on doors and generally reaching out to people directly to help people access appointments. This is something that our ambassadors and others have been doing throughout the pandemic and especially throughout the vaccination campaign. These community ambassadors, hundreds of them, will be out engaging in the community, encouraging vaccine uptake, and giving people all the information they need on third doses and how to access them. Fifthly, special event vaccine clinics in targeted neighborhoods. An example of this is the dedicated vaccine clinic which the City of Toronto is supporting for Black, African, and Caribbean communities to be held at the Jamaican Community Association Centre on January the 16th. Councillor Cressy will have more to say about this strategy on which he's played a leading role, but the bottom line is that we're continuing the work we have done throughout the pandemic to make sure everyone, everywhere in our city has access to the vaccines. It has been a foundation principle of the way in which we've managed the entire pandemic that we've devoted special attention and special resources, as properly should be the case, to those neighborhoods facing special challenges in many respects, including an overrepresentation among those who've been infected by the COVID-19 virus. We're also continuing to manage the impact of Omicron on our city staff. As we've explained, and we are seeing around the world in all cities with respect to their different city services, and in all organizations, including hospitals and, for that matter, private sector employers, the variant spreads quickly, leading to a higher number of unplanned staff absences due to COVID-19, to isolation requirements connected to that spread, or to caregiving for loved ones who are infected and require people to stay home from work. Our absolute laser focus remains on protecting essential and critical services. Chief Pegg will have a further update, but I want to thank the men and women of our frontline emergency services who are doing everything they can and more to make sure these services are kept going through the incredibly difficult period of the pandemic and all that has flowed from it. And I want to thank the city staff who have been redeployed or who have volunteered to be redeployed so that we can keep all the critical and essential services going. I've had many conversations over the past period of time with hospital CEOs, and I know our hospitals are working hard to deal with the same issues while also trying to care for people who are seriously ill from COVID-19, elevated numbers of people who are facing that predicament. We have been very open with the public, indicating that, like most other employers, we have COVID-related staffing issues, including with EMS. We are indeed laser focused on maintaining critical and essential services for Toronto residents, and that is exactly what we've been doing, including at EMS. And I want to thank Chief Raftis for the work that he has been doing and all of the men and women in the EMS service since the Omicron phase of the pandemic began in particular. This situation is made even more challenging by elevated call levels and by hard-pressed hospitals. Ambulances then being delayed at those hard-pressed hospitals in handing off their patients to the hospitals and having to remain at those hospitals. Our paramedics and other first responders are working together to adapt to this temporary situation, including cooperative arrangements to make absolutely sure that people with urgent health situations receive the service they have the right to expect. While our emergency management group review these challenging numbers every morning with Chief Raftis, any life-threatening call remains the top priority, even if response times to non-urgent calls may be altered from time to time. We remain laser-focused on ensuring people in urgent situations know that when they call, we will respond. And that is exactly what we have been doing, and that is exactly what we will continue to do. During these trying times, I want to thank the hospitals for working with us to try to help reduce offload delays and get our EMS crews back on the road as quickly as possible. That is a significant part of meeting this challenge. We are all working together, as you would expect, to get through what our health officials tell us will be the worst of this variant over the next few weeks. I want to also thank everybody who is being safe and cautious right now, who are stepping up to get their third doses, who are wearing their masks, and following other public health advice with respect to gatherings and things like that that are only going to contribute to the spread of this virus if people don't pay attention to those guidelines. While we're in the midst of confronting the Omicron variant, we can't forget that we will get through this tough period and through the pandemic, and then we will get back to a much more normal life and the new but very welcome challenge of having a full recovery for our city so that we can be stronger than ever in every respect. That includes all of the parades and festivals that we use to celebrate in person together as a city, and they're such an important part of our life. They contribute to our quality of life overall, and they also are important to the economy and to communities like our arts communities in the City of Toronto. I'm announcing today that the City has opened applications for the $1.785 million Cultural Festivals Funding Program, which aims to increase the accessibility, the accountability, and the transparency of city funding for cultural festivals. We do recognize, as a city government, the significant role that cultural festivals play in the vibrancy, livability, and prosperity of Toronto, and their close relationship to the city, given reliance on city permits and services and funding. This program is one where we are supporting economic recovery for the arts and for the culture sector, along with communities, businesses, and marginalized community event organizations who have been very hard hit by COVID-19. This program was developed in consultation with stakeholders and communities seeking city support and meets the city's commitment to improving grant processes, increasing access for diverse cultural communities, and supporting activities outside of the downtown core. Designed to support the development of the festival sector, the program also promotes access, equity, inclusion, and service innovation through eligibility requirements. In recognition of the varying levels of size, capacity, and community impact of festivals, the program includes 3 streams: multi-year operating, annual operating, and project grants. Long-standing major annual events such as Pride, Toronto, Luminato, and Toronto Caribbean Carnival will be eligible for multi-year funding and annual grants. Other established festivals will be eligible to apply for annual operating funding up to $150,000. And smaller and newer organizations and festivals produced by business improvement areas will be eligible for project grants of up to $25,000. One of the reasons to talk about this now is that the application process will be open immediately, but will close on February the 11th, 2022. And organizations will be notified of their success or otherwise disposition of these applications by the end of March. And this is so that people can have certainty, so they can make the plans that will be such an important part of our recovery of the city. And it means that we'll be able to do that well ahead of the planned summer festivals and other events of this kind. This program will help to drive the economic and social recovery of the city from the pandemic as we look ahead with cautious optimism to summer festivals. I invite eligible applicants to review the guidelines and to apply at toronto.ca/culture grants. You've heard me say many times that I want Toronto to come back stronger than ever in the wake of this pandemic, and that's exactly what we all want for our city, to come back stronger than ever, which we can do. Our efforts to help people in all neighborhoods, without exception, to get vaccinated, first, second, and now third doses, and children's doses for that matter, this will help to ensure that we can come back as quickly as possible and stronger than ever. Our efforts to support cultural events through the pandemic and through this upcoming year will help to ensure that as well. And these are all important things that we have to do, both managing in the face of the pandemic at present to step up and support groups that need support, including those who need extra support, and planning ahead for the days of recovery that surely lie ahead, hopefully much sooner than later if we all continue to do what we've been doing. It's now time for Dr. Davila to deliver her update for today.
Thank you, Mayor Tory, and good morning. In recent weeks, we have seen a surge of cases as a result of the highly contagious Omicron variant spreading in the community. Hospitalizations and ICU admissions have also risen. As provincial testing resources are overwhelmed and exhausted with such widespread infection, indicators like the number of outbreaks, hospitalizations, and ICU admissions are particularly important to understand the nature of the pandemic at the moment. We continue to see COVID-19 outbreaks in congregate settings, of which the majority, or a little more than 50%, are in hospitals, long-term care facilities, and retirement homes. While this is unfortunate, Toronto Public Health and our healthcare partners will continue to work intensively with all congregate settings to contain outbreaks as quickly as possible and to prevent future outbreaks through focused infection prevention and control, isolation, and vaccination. The increase in outbreaks also demonstrates the extremely high level of transmissibility of the Omicron variant. Because of the virus's high degree of transmissibility, I want to encourage all Toronto residents to get their booster dose of vaccine as soon as possible. It is important for residents to receive this layer of protection against COVID-19, as it helps to increase vaccine protection that may have decreased since the second dose. You may have seen some reports in the media that our healthcare partners, including pharmacies, are seeing some individuals refuse the Moderna vaccine and opting to wait for future Pfizer shipments from the federal and provincial governments. In our immunization clinics, run by the City and Toronto Public Health, we are seeing about 2 to 3% of individuals walk away at the time of their appointment, declining Moderna and choosing to wait for Pfizer instead. I encourage you not to wait for your booster or third dose of COVID-19 vaccine, but to take the first vaccine available to you. The Moderna COVID-19 vaccine has been shown to be as effective, and in some studies, more effective at protecting individuals against hospitalization, ICU admission, and death than the vaccine from Pfizer. What's more, it is also safe and effective to receive what we call a mixed dose series, for a first, second, and third dose of COVID-19 vaccine that are not the same vaccine brand. And if you are over the age of 60 and you have not received a third dose of vaccine, I strongly encourage you to do so without delay. The risk of complications, such as hospitalization related to a potential breakthrough infection prior to the receipt of a third dose, increases as your age increases. Toronto Public Health data show that individuals above 60 have a much higher risk of hospitalization due to a breakthrough COVID-19 infection. The immune system is less robust in older individuals, likely leading to more advanced loss of protection from 2 doses of vaccine. This means that if you are over the age of 60, you have a higher likelihood of serious complications from COVID-19 infection. You need your third dose of vaccine as soon as possible. And as I have said already, please don't hesitate based on the brand of vaccine offered. The vaccines that we are offering are safe and effective. And remember, the Moderna COVID-19 vaccine has been shown to be as effective and in some studies more effective at protecting individuals against hospitalization, ICU admission, and death than the vaccine from Pfizer. I also want to encourage parents to vaccinate their eligible children and for expectant mothers to get vaccinated in order to pass on antibodies to their newborns who are too young to get vaccinated. These vaccines, again, are safe and they are effective, and they are the best way to protect children from short-term and long-term health impacts from COVID-19. I know the next few weeks will challenge us as research and the experiences of other jurisdictions suggest that the Omicron wave will reach its peak in this time. Please do everything you can to protect yourselves and your communities, including vaccination. We at Toronto Public Health will continue to do everything we can as we continue heading up the curve of this COVID-19 wave. It is important to remember that pandemics wane and they do end. Through our concerted individual and collective efforts, we will get through this. Time and again, Torontonians have come together and pushed through the most difficult periods of this pandemic. I have been and continue to be inspired by the resilience and the collective will that I've seen from Torontonians, and am so thankful for the incredible efforts and sacrifices that so many of you have made to protect and support each other. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good morning. We continue to respond effectively to the challenges associated with the Omicron wave of the COVID-19 pandemic in Toronto. We have effective and workable plans in place, ensuring that the services our residents need the most continue to be delivered. This morning, I will provide an update on the delivery of emergency and critical services in Toronto. Yesterday, our emergency and essential services operated with an average unplanned absence rate of 12.8%. Between December 23 and January 9, our emergency and essential services operated with an average unplanned absence rate of 11.9%. Our team continues to implement their mitigation plans effectively, thereby ensuring that these essential services continue to be delivered across the city. From a city-wide perspective, yesterday, we operated with an average unplanned absence rate of 10.5% across all the city divisions. Across Ontario, healthcare services are experiencing increasing pressures and challenges related to the COVID-19 pandemic. This certainly includes Toronto Paramedic Services, who continue to respond to these same challenges in an effective and efficient means on a daily basis. Toronto Paramedic Services continues to work in direct collaboration with both Toronto Police and Toronto Fire Services, and have strong contingencies in place to ensure that our city remains safe. Higher risk and higher priority calls will always be responded to first, before lower risk and lower priority calls. During busier periods, there may be delays in responding to lower priority calls, while we respond to the higher priority calls. Low priority calls that are held receive regular callbacks to check for changes in patient condition. In response to the system pressures arising from COVID-19, Toronto Fire Services continues to respond to a number of lower priority paramedic calls where there is no clear indication of a patient or injury. Upon arrival, if a patient is identified who requires the expertise of a paramedic, Toronto Fire Services will initiate patient care and notify Toronto Paramedic Services, who will then respond. This is one of the ways that we are maximizing paramedic ambulance availability for high priority calls. At present, in-hospital wait times, commonly referred to as offload delays, are the most significant factor contributing to Toronto Paramedic Service ambulance availability and overall emergency pre-hospital system pressures. Over this past weekend, there were times when more than 50 Toronto Paramedic Service ambulances were out of service in hospital, waiting to transfer their patients to the care of the hospital and subsequently return to responding to calls as required. Chief Raftis and the Toronto Paramedic Services management team continues to work with hospital partners to quickly release paramedics from hospitals so that they are available to respond to emergency calls as very quickly as possible. This work and these discussions are continuing. I would like to remind everyone that patients being transported to hospital by ambulance will be taken to the most appropriate hospital based on their condition and location. Requests to be transported to a specific or a preferred hospital are not possible. Further, in order to ensure the fastest possible response to high priority patients, there are no geographical borders for ambulances. The closest ambulance is always chosen to respond to high priority calls, regardless of the location. For example, Toronto paramedics respond to a small number of high priority emergency calls in Peel Region, York Region, and Durham Region every day. Likewise, Ambulances from these areas also respond to a small number of high-priority calls in Toronto every day. The Toronto Paramedic Services Communication Centre is internationally recognized as an accredited centre of excellence. Our emergency medical dispatchers and call takers are experts at triaging all emergency calls using the Medical Priority Dispatch System. Each and every day, our Toronto Paramedic Services team delivers world-class emergency pre-hospital care. And I thank each and every member of this dedicated team for all they are doing under these increasingly challenging conditions. Each of our other emergency, essential, and critical services, including police, fire, Toronto Water, TTC, shelter support and housing, senior services and long-term care, children's services, and our city-operated COVID-19 vaccine clinics also continue to provide exceptional service to Toronto residents, and I thank them also. Each of these teams continue to do an exceptional job of managing through the challenges associated with increased numbers of staff being unable to report for duty as a result of COVID-19. Our COVID-19 Strategic Command Team continues to work every day in order to ensure that all aspects of our citywide response to the pandemic remain responsive and effective. As the situation with COVID-19 evolves, so does our planning and response. I encourage you to continue to make toronto.ca/COVID-19 your first choice for up-to-date, accurate, and timely information on all aspects of COVID-19 response in Toronto. Thank you. I'll now invite Councillor Cressy to bring his remarks.
Well, thank you, Chief Pegg. Today I want to tell you a little bit more about our updated 5-point action plan to bring third dose booster shots to under-vaccinated neighborhoods in our city. Since day one of this vaccination campaign, we've implemented a multi-pronged Team Toronto approach to ensure everyone in this city, in every neighborhood in the city, can access vaccines. As Mayor Tory said so well, getting vaccinated shouldn't depend on your postal code or your economic status. When it comes to vaccines, well, they're about more than individual protection. They are a population-wide public health measure. Yes, vaccines protect individuals from serious health consequences from COVID, but they also protect those around you, your family members, your work colleagues, your friends. And it's in that sense that when it comes to vaccinations, the adage that we're all in this together is absolutely true. To protect everyone, we must reach everyone. It doesn't matter if the vaccination rates in Rosedale and Forest Hill are great. Rather, it matters that the vaccination rates in Rosedale and Rexdale are great. The vaccination rates in Forest Hill and Flemington Park are great. And in this vaccination campaign, we truly are all in this together. And that's exactly why at Team Toronto, we're scaling up our efforts to accelerate third dose booster shots in targeted neighborhoods right now. Now let me give you some context. Last spring, at the beginning of this vaccination campaign, we worked with our community and healthcare partners to launch the Sprint strategy. It was a campaign to bring first doses to under-vaccinated neighborhoods through mobile clinics, community-based outreach, neighborhood ambassadors, and task forces like our Black Scientist Task Force. The Sprint strategy worked. Together, we successfully increased vaccination rates in hard-hit neighborhoods. We proved that in a city like ours, a city with 3 million people, 200 different ethnocultural groups, a city where 140 languages are spoken and half of our residents are born outside of the city, we proved that by working together, we can succeed together. And so as we accelerate our third dose booster campaign, Team Toronto is once again rolling out an action plan to increase vaccine uptake in targeted neighborhoods. Our action plan, as Mayor Tory outlined, has 5 elements. First, hyperlocal clinics in Toronto community housing buildings. Second, school-based clinics for kids, family members, and education staff in targeted neighborhoods. Third, dedicated appointments by postal code and neighborhood at vaccination clinics. Fourth, community-based outreach by 155 community agencies and more than 400 neighborhood ambassadors. And finally, targeted special event clinics organized by and for specific population and neighborhoods, such as this weekend's upcoming Black African and Caribbean Communities Clinic at the Jamaican Community Association. And I want to delve just for a minute into this action plan and the specific role of neighborhood ambassadors. Last spring, we launched the Vaccine Neighborhood Ambassador Program. Since then, we identified, trained, and hired 410 local leaders. These are trusted local Torontonians. And for 9 months, these ambassadors have been the unsung heroes of this vaccination campaign. They go door knocking in TCHC buildings before clinics. They organize school-based clinics with local principals. They host vaccine info sessions at places of worship, in mosques and synagogues, in churches and temples. And so our third dose campaign, like our whole vaccination approach, is grounded in this type of local community outreach. Hyperlocal clinics and community-based outreach. Boots on the ground in every language spoken. This is the model that has worked for us before. It's the model that enabled Toronto to become one of the world leaders in vaccination rates amongst major metropolitan cities. And it's the model that will work again as we continue to accelerate the booster campaign. You know, in just over a year, more than 6 million doses have been administered in our city. Nearly 90% of all residents over the age of 12 have received their first dose. As of this morning, more than 1 million booster shots have already been given. It is a remarkable achievement and a testament to millions of Torontonians who have rolled up their sleeves and thousands upon thousands of frontline, community, and healthcare workers who have made this happen. This is Team Toronto. It is and involves all of us coming together to protect each other. And in this booster campaign, once again, we are all in this together. That is our commitment. That is the Team Toronto way. With that, I'll turn the floor back over to Brad Ross, and we can open up for questions.
Thank you very much, Councillor Cressy. We will now go to questions. For reporters on the line, just so you know, Chief Paul Rathbus from Toronto Paramedic Services is also on the line. We'll go first to Scott Laurie from the Toronto Sun. Good morning, Scott. Please go ahead.
Thank you very much. Question for the Mayor. Mr. Mayor, you mentioned in your comments that this is a temporary situation with EMS, the problems that they noticed over the weekend. How much study is being done to find out if this is a problem that's built on the foundation of a more systemic problem?
Maybe you could just clarify, Scott, and thank you for the question, what you mean by a systemic problem. Systemic in what nature? If you just clarify that a bit, I'm happy to answer the question.
Well, the union has said that this is a problem that they've noticed for years.
Okay. Well, I will say first and foremost that well before, or certainly commensurate with the beginning of the pandemic, but unrelated to the pandemic, we've had a hiring plan for the EMS, and we obviously base that on the recommendations coming from the chief. But I would say that now we're faced with extraordinary circumstances, which are faced by other elements of the public service and by the private sector, for that matter, in terms of the impact of Omicron in particular on staff shortages. And I should say it's also a system-wide problem in the context of it having an impact on hospitals as well. And I think what we have done and what we will continue to do is to develop and implement a plan and modify it as required to make sure that we can answer the calls that have to be answered. And as I said in my remarks earlier on, when it comes to Torontonians who have urgent healthcare matters that require reference to EMS, and when they call, we will answer those calls. We have been answering those calls. We will continue to answer those calls. That is our job, and we have got the backs of Torontonians when it comes to getting that done.
Follow, Scott.
Question for Chief Pegg. You mentioned that the absentee rate right now is 10.5%. How much of that is just an average across city staffing, and what's the specific rate for ambulance, for paramedics, and for fire?
Hi, Scott. So let me just restate. Yesterday, our emergency and essential services, so that certainly includes the agencies and the divisions you spoke about, that was an average of 12.8%. That is an average across those organizations. I actually don't have the detailed breakdown in front of me, but we can certainly take that offline, Brad.
Absolutely. And citywide, Scott, it was 10.5%, non-essential, non-critical. Okay, thank you, Scott. We will go next to Stella Dupuy from Radio Canada. Stella, go ahead, please.
Yes, so my question is for Mayor Tory. So I wanted to know, because there was a cold red this weekend, no units were available to respond to a life-threatening emergency, and that's what the union chair says. Are you alarmed by this? Do you think it could happen again in the following days?
Well, I will ask Chief Raftis to comment after I make an additional comment. One of the reasons we're spending so much time on making sure we have a plan in place to make sure that all of these urgent calls can be answered and have been answered and will continue to be answered is so that we can assure Torontonians that that is the case. And I can assure them that is, in fact, the case. I think we have to take note of the fact that when different kinds of notifications come up in the context of the delivery of this kind of service, that is a time when you make a decision to reallocate those resources to make sure you can answer those calls. And that's why you have a plan in place to make sure you can do that. So that we are working hard every day, all day, working with our hospital partners, because you've heard that when you have 50 ambulances technically out of service and unable to answer calls because they're awaiting offloading of patients at the hospital and things like that, these are things that will help us to address this problem. But again, urgent calls have been answered. Urgent calls will continue to be answered, and people can be reassured that we've got their backs, that those calls will be answered, they have been answered, and that we're going to provide service in those instances that the people have the right to expect.
Chief Raftis, anything to add, please?
Yes, thanks very much, Brad. Hi there, Stella. Thanks for the question. So there's no question that we're very busy right now. We're seeing lots of pressure across the system, and these are not normal times. So we do run into situations when ambulance availability is low. This is not uncommon for all large urban EMS systems, and especially right now during Omicron. In these cases, as Chief Peg had noted, higher risk and higher priority calls are always responded to first, and lower risk and lower priority calls may be delayed in these circumstances until more ambulances become available. It's really important to note that in-hospital wait times are the most significant factor contributing to the system pressures, and it's not uncommon for paramedic teams to wait for hours in hospital. So this is a very significant issue that we'll continue to work on. And further to the question earlier about staffing levels, we continue to mitigate our own absenteeism levels very well. So today, as an example, we have 114 ambulances on duty, and best case scenario, we would have 120. So very close to that mark, but it is that time in hospital that we spend that is really the most significant factor leading to these system pressures.
Brad, could I add one more thing?
Yes, of course.
I want to make it clear, I'm sure on behalf of us all, that the paramedics who have been on duty, and of course the vast majority, as Chief Raftis just said, have been, they are doing an extraordinary job for us, an extraordinary job in very difficult circumstances. And that includes the challenge they face and the frustration they often face, because I've talked to them in hospitals, not during the pandemic, but before, when they're waiting and can't go to do what they're best trained to do, which is not to wait in a hospital, but to be out helping people on the streets of Toronto. And so I just want to say they are doing a superb job, and we're trying to help them with plans that can allow them to do that superb job and answer the calls that people expect to have answered, which we're doing.
Thank you. Follow-up, Stella?
Yes, I wanted to know what could be done right now to help prevent those cases. Is there, what are the solutions on the table, maybe for Mr. Peg or the chief that is on the line as well?
Yeah, I'll ask Chief Raftis to address that. Chief.
Yeah.
Thank you, Stella. So I think really the prioritization of the paramedics, getting them out of the hospitals is a critical piece for us. So we're going to continue to work with our hospital partners to do that. We're also focused on our staffing. As the mayor had mentioned, we do have a staffing plan in place. We did hire 200 paramedics in 2021, and we certainly anticipate hiring additional paramedics in 2022. And it's all hands on deck, focused on Omicron right now in the system, and making sure that we prioritize those high priority calls. And unfortunately, in some circumstances, some lower priority calls may take longer to get to. And further to the Mayor's comments, really appreciate those comments. We acknowledge that this has been an exceptionally difficult time for our staff. And they, along with all of the healthcare professionals, are exhausted. Couldn't be more proud of them for their tireless work, dedication, and courage. So we're all going to continue to work together on this and get through this very difficult time.
All right, thank you very much. We'll go next to David Ryder from the Toronto Star. Dave, go ahead, please.
Hi, everybody. This is for Dr. Davila, I think, and maybe Councillor Cressy or anybody else that wants to. Given the challenges that exponential virus growth poses for contact tracing and testing, and in turn alerting the public to outbreaks, should there be widespread testing in schools before kids return to the classroom?
So David, why don't I start, and I'll see if Councillor Cressy would like to join in. When I think we're looking at all the resources, and I know that when it comes to decisions around schools, clearly the lead decision maker are our colleagues at the province. That being said, I think we're all aware of and constantly following the best available evidence in respect of what can help create a safe learning environment and to promote the return to in-person learning, given what we know about how this is an essential activity for our children. So certainly at the local level, with the changes in provincial guidance, our focus is on outbreaks and in controlling outbreaks in the highest risk settings, notably our hospitals, long-term care homes, retirement homes. But certainly we are looking at what the evidence is suggesting in respect of schools and what really makes a difference. From the local level for us, as you've heard us mention over the course of the last several days now, we have been putting a great deal of our time and effort towards vaccination, because that's something that we can actually do here at the local level to create that safe environment within the school setting and to help our school boards and the provincial government move in a direction that supports the return to in-person learning as soon as is possible, recognizing how important an activity this is for kids. Councillor Cressy, I don't know if there's anything you wanted to add.
Well, only to reiterate, as Dr. Davila mentioned, that schools are essential for the health and well-being of our kids, and we're doing absolutely everything we can to support our provincial and school board counterparts to safely reopen. Everything from ventilation to PPE and, of course, testing, which is the purview of our provincial partners. And at the local level, what we're doing nonstop, day and night, right now, is boosting vaccination rates amongst both our kids, 5 to 11 years old, but also education and childcare staff. Just this weekend, we hosted 2 dedicated clinics yesterday in Woodbine, as well as in Scarborough. We have 27 school-based clinics this week, not only for kids and families, but for education staff as well. And we're going to do everything we can here at the local level to support a safe return to school.
Thank you. My follow-up, I think, for also Dr. Davila and Councillor Cressy or anybody else. Dr. Davila, in September, you said COVID-19 should be added to the 9 diseases for which students currently need to be vaccinated to attend school. Given the explosion in Omicron infections, do you still believe that?
So David, you're quite right. We at Toronto Public Health took a position on this in the fall, and that was adopted by the Board of Health as well at the meeting in the fall. And to my mind, this is a fairly simple and straightforward issue. We have a safe and effective vaccine that provides protection for our children and the people around them against a disease that is wreaking havoc. And just like the other vaccines that we provide to our children for their own benefit and the benefit of the community around them, I think COVID-19 vaccines should be considered in exactly the same way.
Okay, thank you. We'll go next to Sean Lethon from CTV News. Sean, go ahead, please.
Hi there. Just to go back to the conversation around ambulances. Yesterday, when we spoke to the member of the union, he spoke in much more dire terms, saying that he believed the system was on the verge of collapse and that the members are exhausted. In fact, stopped taking overtime that's being offered up. I guess I would like to get your response to that comment specifically, that he felt that the system itself was on the verge of collapse.
I'd like to start off, if I might, Sean, and thank you, and then ask Chief Raftis to comment as he might wish. We acknowledge the fact that people in all walks of public service, especially first responders, are all going to be exhausted by the stresses and strains placed on them by the pandemic, and probably no group more so than paramedics, who have been facing not only the calls that they would normally face with different kinds of things that are obviously very trying in nature, but also by the addition of the pandemic and the further complications arising out of staff shortages due to absence because of illness, and some of the problems that we've had, for example, in the hospitals. And I would just say that the good news is, however, that many continue to step forward, most for duty. Many continue to accept overtime when it's asked, and they continue to do service above and beyond what normally would be required of anybody. And our objective under the leadership, which I can tell you has been sound and has been steady, of Chief Raftis, has been to make sure we have a plan in place which ensures for Torontonians that we have their back at all times, and that when they have an urgent healthcare problem, that we respond with the same urgency to address that and to show up when they call. We have the backs of Torontonians. We will continue to do so. That is something that is not debatable, but I recognize the fact that there are many, many people, including at the top of the list, paramedics, who faced immense stress for a long period of time now, and that's why we need to get this pandemic over with.
Chief Raftis.
Thanks, Brian. Yes, just building on the Mayor's comments, there's no question that our staff are exhausted. They've been working like crazy for the last 22 months, absolutely tirelessly, and their dedication has been so impressive. We do continue to have many staff take overtime. I think that's true that people also need their breaks. So, but we still do have people taking overtime within the system. And we're trying to do quite a number of things to help support the system, along with working with our hospital partners. We've also been working very closely with Toronto Fire Service and Toronto Police Service. So we actually have Toronto Fire Service temporarily responding to a number of low priority calls where there's no clear indication of a patient or injury, to try and reduce some of the calls that we would normally go to. So again, our staff continue to work tirelessly, so proud of them, and I do agree that they are exhausted, and we'll continue to do everything that we can to support them, working right through this particular wave.
Brad, if I may, just one more comment. We have been trying as a city administration throughout, and we will continue to try, because it's my approach and that of the leadership team here, to address these kinds of challenges when they arise in a constructive manner and to look for solutions. And we've had a good working relationship with the union, with other partners, including in the healthcare system, with other governments, and I will be continuing to try to find ways to work together to address these challenges, which are unprecedented in scope and do have a negative impact on first responders and on many others and on people that live in the City of Toronto. But I will continue to approach these things in a constructive manner, looking for solutions, because I think that's what people expect us to do.
Follow-up, Sean?
Yes, changing gears to the situation in homeless shelters around the city. On a day where it's this cold and the cold weather alert has been issued, we're hearing that the city's homeless shelters are filling up at the same time they're dealing with outbreaks of COVID-19. Can you give us an update on the situation in the city's homeless shelters and what you plan to do to mitigate those outbreaks?
Well, I'll start, and others may wish to chime in. Do we have Gordon?
Oh, yeah, Mr. Tennyson.
We have, again, been talking about this every single day. And we talk about it within the context of the staffing impact that they have experienced because of illness due to absence due to illness rather, and other factors that relate to the occupancy rates of the shelters. And as recently as this morning, with the cold weather we've been experiencing, we've talked about what we can do to make sure that the capacity that is needed to house and shelter those who are experiencing homelessness is there for them. I will also say that we've been making an extraordinary effort to make sure we not only protect the people experiencing homelessness within the context of shelter for them, but also vaccination, where since the advent of vaccines, we've had 1,300 shelter clinics with 154 more shelter clinics scheduled for the month of January in order to ensure that we can have vaccination rates among the population of people experiencing homelessness that is as high as it can possibly be. But this is something that is on our radar screen every single day for discussion, along with things like the EMS and other things that challenge us during what is a very pressure-filled part of the pandemic so far.
Staff Coordinator, the General Manager of Shelter Support and Housing, if you had anything to add, Gordon.
Yeah, sure, and thanks for the question. To build on Mayor Tory's remarks, certainly I know we are laser focused on the need to have available shelter space for people, specifically during these cold weather events. And so last night our warming centers ran at about a 90% occupancy. We will be adding additional beds as we head into this evening. And, you know, within the shelter system, you know, similar to Chief Raptis, I mean, we've got a courageous bunch of frontline people that continue to show up day in, day out to make sure that people experiencing homelessness in this city have the support they need and it's available when they need it. We've rolled out additional protective equipment to all of our shelters, rapid tests, as well as really focusing on those vaccine clinics that the mayor referred to. We've recently rolled out a $4 pandemic pay boost to some of our frontline staff working in nonprofit organizations, and working very closely with our city colleagues to ensure that we have the staffing available to deploy to some of our frontline services should we need them in the days and weeks to come.
Councilor Cressy, is something that?
I just wanted to add on the vaccinations front in particular. Mayor Tory spoke to it, that we have taken an approach since the very beginning that we must vaccinate the most vulnerable as quickly as possible. And that's because vaccinations continue to be our best line of defense against severe outcomes if one comes down with COVID. And within our shelter and drop-in system, we would acknowledge that often it takes more than a single clinic. In fact, we often have repeat visits where you're having 3, 4, 5 clinics at the same shelter or drop-in site in order to reach everyone, because that's the objective. And so we've had since April 1,318 vaccination clinics at more than 100 shelter sites. But we've accelerated just in recent days that we will now have 134 clinics in the month of January alone across our shelter and drop-in sites. And we will continue to accelerate, working with our healthcare partners like the Inner City Health Associates, to boost this vaccination campaign, to vaccinate the most vulnerable as quickly as possible. That is our commitment, and that's what we are going to continue to do every day, every hour with this population.
Thank you. We'll go next to Mike Walker from CTV News. Go ahead, Mike.
Thank you. My first question is for Chief Raptis, and maybe Chief Pate may want to touch on this as well. Just following up on the EMS issue, talking about the offload issues and working with the hospitals. Understand that hospital staffs are strained as well. What more can be done to speed up those offload times? And is there any other contingency plans being considered right now with this peak not expected for another 4 to 6 weeks?
Chief Raptis.
Thanks very much for the question, Mike. Yes, in terms of the offload piece, so it is a challenge and the hospitals are pressured. But we know that the high-performing hospitals really focus on the flow out of the emergency department and prioritize the paramedics and keep them moving through. So that's really a key focus for us. And it does offer the greatest opportunity for success in terms of time available. Of course, we continue to work with our partners, Toronto Fire, Toronto Police Services, to look at all opportunities in terms of efficiently responding to emergency calls. We do utilize overtime and maximize the use of our staffing and part-time staffing who are available for us. And we continue to work with our neighboring services. So Chief Peg had also mentioned that a few times a day we share calls back and forth between the services to make sure that in fact we're responding to the closest patient who has a high priority incident happening. And then really finally, it's all about that real focus on triage for those high priority, high risk calls. We respond to those first. and sometimes there would have to be some delays to the lower priority calls. We're also reaching out to the public to talk to them about really thinking about the use of 911 and making sure that 911 is for emergencies and it's not for very low priority calls such as flu-like symptoms, that sort of thing. So we continue to do that as well to focus on keeping the system safe and responding to the calls as they come in.
Follow, Mike?
For Chief Pitt, how often are your firefighters responding to these low priority calls now out the staffing shortages EMS are facing? What sort of strains, if any, is that putting on your crews?
Hi, Mike. It amounts to about 60 calls in a 24-hour period is the net sum of the volume of those calls. So not an insignificant number of calls, but certainly something that is being effectively managed. The mitigation plans that Chief Rafta spoke about that are live within paramedic services, equally live within fire, police, and all the other essential and critical services. So those low priority responses are being well managed, they're being well tolerated in the system, and something that is literally being managed and observed and watched, if you will, on a lifetime basis every day by the 3 management teams across emergency services as well as our COVID-19 strategic command team.
Thank you. Our final question is from Doug Gaby of Global News, who's operating our camera today. Doug's just going to come over here and ask this question.
Hi, everyone. I just want to circle back to staffing issues with the paramedics. Unquestionably, burnout is happening with these individuals. It's people are leaving for other jurisdictions. They can't handle it. What is being done for them in real time? We're understanding that the staffing crisis has got to the point where you're buying back vacation from these paramedics, a time and a half. How does that solve the problem? These guys are burning out and they're going on vacation, and now they're going to leave their vacation and come back and work. How sustainable is this model?
Thank you, Doug. I'll ask Chief Raftis to address that. Chief?
Thanks very much, Doug. Yes, we're looking at all options to support our paramedics. We have very comprehensive staff support services for our staff, including peer resource team and other supports for them. In terms of those other options, we're providing those options again in terms of allowing staff options that they hadn't had in the past to continue to improve staffing, considering that vacation right now, many people's vacations have been canceled in terms of travel and those types of things. And we're making sure that there is the availability of support from all of our leadership team and those types of pieces. In terms of people leaving the organization, there are people moving around in all sectors at the moment, no question about that. It is a little bit higher than normal years, but you would see right across all sectors that that's true of people moving to different jurisdictions. We have maintained the very vast majority of people that we have hired in this past year, and as the Mayor had said, we do have a staffing plan that was approved by Toronto City Council, and we'll continue to focus on that staffing plan to support our frontline paramedics and ensure we have the right number of paramedics out on the street.
Mr. Mayor, I want to make a comment and say this. Extraordinary times have required extraordinary measures, extraordinary options to be put on the table, extraordinary actions to be undertaken, and sometimes chosen by many different people, including the hardworking paramedics. And I'm proud of the fact that we did put in place a hiring plan that was approved by the City Council that has resulted so far in the hiring of hundreds of new paramedics, and will result in the hiring of more. But we're in an emergency situation now, and I so admire the sacrifices and the dedication of the paramedics to helping us to meet that emergency in exemplary fashion. But it does obviously require us to put in place steps and measures and options that wouldn't normally be considered, as has been the case for many, many people during the course of something that we hope to have over with as soon as we can.
Thank you very much, and thank you all for joining us. That concludes today's briefing. Please stay well.
Cheers. Thank you. Thank you, Chief. Thank you, God. Have a good one. Sure.
Thanks, Doug.
Thanks, Bud.
Take care, guys. Thank you.
Yeah, see you tomorrow, bro. You're
Yes,
coming in,
tomorrow,
right?
yes, I'll see you tomorrow.
All right.
Melissa, did you have to come in? Did we find out?
Yeah, Brad's going to be on site, and apparently Rob has changed jobs, so some guy